Hello. Today we're going to chat about something that we all have, mental health or mental wellness. There's good mental health when we feel joy, are active at work and caring for our families, and have things we do that make us happy. Mental illnesses are on the other end. They can negatively affect a person's thoughts, feelings, mood, and ability to relate to others. Let's get to know some of the symptoms of a mental illness. For many people, mental illness is felt in our emotions, how we're feeling, what we're thinking. What people may not realize is that mental illness is also felt in our body. Maybe your stomach or head hurts, or it is difficult to get out of bed. Maybe you have a hard time sleeping or staying asleep. Even when you're tired, your heart might be racing, or you're hearing voices and seeing things that are not there. These are all signs that your mental health might need attention from a professional. Don't worry, it's not your fault, and it can happen to anyone. We all have stress in our lives, and when that stress becomes too much, these symptoms may keep us from feeling like ourselves or functioning in a healthy way. It's important to see a doctor or mental health professional to figure out what is going on and find the right treatment. Sometimes stress can come from events or experiences we've had, like accidents, wars, or discrimination, even if they were a long time ago. This stress might be called trauma and may look like recurring bad dreams, avoiding certain places, blaming yourself, or feeling jumpy from loud noises. Trauma can lead to higher chances of mental illnesses like depression and anxiety, even medical conditions such as diabetes and high blood pressure. It can be hard to talk to someone about what you have faced or seen, but it is important to tell the information to a doctor or mental health professional so they give you the best treatment. Finding help is a brave step towards feeling safe in your body, home, and community. Remember, you're not alone, and it is okay to ask for help. If you need help with your mental health, it's important to find treatment. Seeing a doctor first can help rule out any other health conditions that could be causing these symptoms. If your health is okay, then you will want to see a mental health professional, often called a therapist. To find one, call the customer service number on the back of your insurance card. If you do not have insurance, go to a mental health center, which provides free or low-cost mental health care. There are a limited number of culturally diverse mental health professionals. A great way to find one is by asking someone you trust if they know of anyone. You can also use an online tool like Fast Tracker, aman.org, or go to the NAMI Minnesota website. Therapists specialize such as working with someone who experienced trauma or has anxiety. Don't be afraid to ask questions before you make your first appointment. You can also ask if the therapist has experience working with clients who share your age, cultural identity, sexual orientation, or faith. If you need help right away, you can call 988, the National Suicide and Crisis Lifeline, your local mental health county crisis team, or go to the emergency room. If you might hurt yourself or someone else, you might want to call 911. When you call, you ask for a crisis intervention team-trained CIT officer and explain that you or a loved one is in a mental health crisis. A crisis intervention team-trained officer is someone who has learned how to safely de-escalate a situation and knows of hospital emergency services and mental health resources to help you or a loved one. Be clear about what you want to have happen. Officers may ask you if you want to be transported to the hospital. Many people talk with a therapist. A therapist will ask you about your symptoms and will want to know a little about your life. They do this so that they can figure out what you may have, to figure out if you have depression, anxiety, post-traumatic stress disorder, or another mental illness, and how to help you. A therapist can help you think about things in a different way. There are also different types of therapy that can be very helpful, including cognitive behavioral therapy, known as CBT, dialectical behavioral therapy, known as DBT, eye movement desensitization and reprocessing, also known as EMDR, and psychodynamic therapy, known as PDT. If you want to learn more about these therapies, contact NAMI Minnesota at the phone number and email at the end of this video. When talking with a mental health professional who may not speak your language, language assistance is available to you at no cost. Don't use a family member as an interpreter. Professional interpreters are unbiased and have been trained to understand medical vocabulary. Sometimes family members may give their version of events or omit words that they do not know how to translate. This can lead to a misdiagnosis. Some people may need more intensive care, like in a hospital, residential treatment, or intensive outpatient treatment. There are also a variety of programs that can be provided in the home. If you need help figuring out how to get treatment or find a therapist, NAMI Minnesota is here for you. We provide education, support, and advocacy. We also offer free classes for family members, professionals, and community members who want to learn more about mental illness and the mental health system in Minnesota. In addition, we offer peer-led support groups for families and people living with mental illnesses. All groups are free to attend. You can call NAMI Minnesota's helpline at 651-645-2948, which has on-demand interpreters in over 100 languages, including Spanish, Somali, Hmong, Karen, and Oromo. You can also visit our website at www.namimn.org or email us at namihelps@namimn.org for more information. Remember, it is okay to ask for help, and you deserve to feel safe and healthy. Take care of your mental wellness. You are not alone.